Good afternoon, and thank you for joining us for our weekly update. I want to recognize that it is Public Works Week, and I want to thank our hard-working City of Mississauga and Region Appeals staff who keep Mississauga moving and ensure that our residents can continue to count on key services that they rely on a daily basis. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health at the Region of Peel, and Tim Beckett, our Fire Chief and also head of our Emergency Management team. Earlier this week, we were notified by the province that Peel Region, and by extension Mississauga, would remain in Stage 1 for now. I know this is frustrating for many residents and our businesses, but unfortunately, cases across the Region of Peel remain the second highest in the province, accounting for roughly 20% of all new cases, and of course we are 10% of the population. The province made this decision based on evidence and facts, and we can't ignore that. Evidence and science must continue to guide our decisions. We may be done with the pandemic, but unfortunately it is not done with us. We need to control the spread of the virus to avoid a larger second wave. We also need to make sure that we are on the right side of history. Our people and our businesses cannot afford to do this again. We are in a good position here in Mississauga, but we must remember that the virus does not follow geographic borders. Mississauga is part of Peel Region, and we must move forward as a region. There is only one direction we are heading here in Mississauga, and that is forward. Cases are stabilizing, and we are now on the back end of the curve, and with an average of roughly only 13 new cases a day, with only 202 active cases in Mississauga. We have seen steady declines over the past week, and I'm confident that we will meet the threshold to move into Phase 2 very shortly. Dr. Lowe will be revisiting our progress as a region with the province throughout the week and keep them updated. If things go well, we are able to keep our numbers down. It's possible that Mississauga could receive approval from the province to enter Phase 2 within the week. My message to businesses is get ready. Get ready to open your doors. To my residents, while it's tempting to venture outside the city to get that first summer patio session, please stay local, stick it out, and show your support to our local businesses. They are our friends, our family, and our neighbours. We've sacrificed so much in the past 3 months. We can wait it out for another week or so just to see our favorite barber or our favorite hairstylist. Our restaurants, the service and the tourism industry have been hardest hit by this pandemic, and when they open their doors again, they will be relying on us, their family and friends and neighbours, and their entire community for support. In the meantime, please don't let your guard down and continue to practice the basics when it comes to COVID prevention. If you are displaying symptoms or are worried about exposure or are at a high risk of getting COVID due to the nature of your work, please go and get a test. Our second mobile pop-up testing site will happen this Friday at the Meadowvale Community Centre from 10 to 6 p.m. Think about how far we've come. Your work and that of our neighbours has helped us avoid the worst case scenario, but our work, unfortunately, is not yet over with. Earlier this week, my fellow GTHA mayors and chairs convened what is now becoming weekly meetings as we navigate this crisis as a wider region. As more regions move into Phase 2, we continue to stress the need for emergency support for municipalities from the provincial and the federal levels of government. Our deficits are ballooning. Mississauga stands at $60 million right now, and it is becoming increasingly difficult to manage. To recover would be like not operating our transit system for 8 months or shutting down the city entirely for 1.5 months, which speaks to the magnitude of the problem which we are facing. Many of us are starting the process of designing our 2021 budgets in the face of no support. We will have to make some very, very difficult decisions, either to raise taxes to make up for the losses in the face of no support, or making large cuts to programs and to services. It's a lose-lose situation for cities and for the people we care about and for the people that we serve. I've spoken to the Premier and the Ministers of Finance and Municipal Affairs, and I know they are committed to striking a deal with the federal government. We understand important meetings are taking place this week between the provincial and the federal officials on this topic, and we urge them to put pen to paper and close the deal. The stare-down needs to end because cities need your support. I also want to provide my residents with an update on the reopening of the remaining city park amenities included in Phase 1. We made the decision to slowly roll out these, starting with individual activities that carried a lower risk. We are now moving to reopen amenities and welcome physically distanced team play. Starting this Friday, June 19th, we will be reopening shared track and field facilities at 3 high schools, Gonzaga, Loyola, and Courtney Park, bocce courts, beach volleyball courts as well. The following Friday, June 26th, we will also be reopening our basketball courts, sports fields for community use, no permits, and all remaining parking lots. We're also moving forward with a modified version of our city-run summer camp programs for this year, starting on Monday, July the 6th, which I'm sure will make many parents very happy. Registration for camps opens at 8:30 a.m. this Monday, June 22nd at activemississauga.ca. That's the website, activemississauga.ca. Our recreation centres, once permitted to reopen, will be used exclusively for camps during the week. Unfortunately, given we needed to modify the structure and capacity of our camps, if you had previously registered for camps, you will need to register again. In the face of this pandemic, we continue to conduct city business and to keep Mississauga moving forward. Today, we hosted our 12th virtual meeting. At Council today, first, we moved to cut red tape to make it easier for bars and restaurants to expand their patios into public areas and parking lots when they are given the green light to open very soon. We also waived several application fees associated with patio expansions to help businesses during this very difficult time. Given that they will be operating at reduced capacity, allowing them to expand their footprint will help businesses accommodate more customers and recover much-needed revenue. I, for one, look forward to enjoying my first patio pint this summer very, very soon. I encourage landlords to work with their tenants to make this work. Without customers, businesses can't afford to pay their rent, so let's make this a win-win for everyone. Secondly, we approved a plan to reopen city park amenities, including in Phase 2, dependent, of course, on Mississauga being given the green light, which we hope will happen as early as next week. We are ready. We have a plan in place to responsibly open facilities included in Phase 2 with proper capacity and proper physical distancing measures in place. Once approved by the province, we will start reopening the following on July 4th. The wading pool at Celebration Square, the splash pads, outdoor pools for fun and lane swims, but pre-registration will be required. You can no longer just drop in for a swim. Artificial turf fields, select baseball diamonds, cricket fields, picnic areas, photography permits in our parks. And as of July 13th, our soccer fields. A reminder to residents, none of these facilities are open just yet. And third, today we are announcing the creation of the Economic Resilience Task Force, which I, as Mayor, have the honour of chairing. This task force will have expert leaders from across our business community that will help us develop plans to support key sectors such as small businesses, tourism, and our creative industries bounce back after this crisis. This pandemic has forced us to think about how we work differently, and this team will also review our city's policies and procedures to determine how we can make it easier for you to do business in Mississauga, moving us forward. I know our business community is hurting right now, and I'm confident that they will rebound from this crisis, but it will take an all-hands-on-deck approach to do so. This will require a firm commitment from our city, and we are here, both in the short and in the long term, to help them with the recovery. Fourth, we lifted the restrictions on the sale and the use of fireworks here in Mississauga. Now that the province has eased the restrictions on the number of people that can gather, enforcement no longer remains as big an issue, and we feel more comfortable allowing fireworks once again. This means that on Canada Day, residents can set off fireworks on their own properties if gatherings remain smaller than 10 and if they follow the rules and safety guidelines. Canada Day is just not the same without lighting up the sky. And now, I will turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on Peel Region's response to the virus. Dr. Lowe?
Thank you, Madam Mayor. Good afternoon. As of noon today, Mississauga has seen 2,494 cases of COVID-19. Of these, 2,074 have recovered, 202 are active, and 218 Mississaugans have regrettably passed away. I know there are many questions around the provincial decision to keep Peel in Phase 1. This past weekend, I welcomed the opportunity to provide my insight around our picture to our Provincial Chief Medical Officer of Health and his team. Through our discussions, my provincial counterparts reminded me of the province's reopening framework that requires a community to see a minimum of a 2-week decline in new cases, in daily new cases. At the time of our discussions this weekend, that was still pending. As our discussions and dialogue with our provincial partners has continued, I have been encouraged that Peel's monitoring indicators continue to paint a vastly improving picture in all 3 of our municipalities. Public health and testing benchmarks are optimal, and rates of COVID-19 hospitalization and severity continue to steadily decline. Most importantly, while our absolute number of cases remains high, I'm pleased to announce that as of today, the region of Peel has observed a consistent 2-week decline in our 7-day moving average of new cases, from a peak of 60 per day on June 3rd to around 40 today. If this overall trend holds, I am confident that we are much closer to Phase 2. We are very much getting there. And I continue to be grateful to Mississaugans for stepping up. As we prepare to reopen more of our lives, we know that we cannot return to the way things were. We know the new steps that we must take in order to stay safe. You are now all familiar with the core 4 behaviors that public health recommends. Staying 2 meters apart when out and about, wearing a non-medical mask when you can't, washing your hands frequently, and if you're sick, getting tested and then staying home. For us to succeed in bringing this first wave to an end, we need everyone to do these measures consistently. We need business owners and community leaders to put in place measures that allow anyone on their sites to abide by these recommendations as they reopen. And most importantly, I ask you to be patient for just a little while longer. Stay local as much as you can. Avoid heading to scenic hotspots, lest they become viral hotspots. And please, avoid traveling to other areas that have gone forward into Phase 2 before us. Enjoy the beautiful weather instead in your local recreation areas, your local parks. You know that the first patio meal will be so much more enjoyable when it's at your local favorite. And by doing so, you will also support our local businesses when the province finally gives us the green light. I personally can't wait for the opportunity to get out there again, especially as I know that many of our community's businesses have made sacrifices to get us where we are, and it's our turn to return the favor. But as we move forward, we must do so safely. We must continue to ingrain the core behaviors in every interaction that we take and take steps to remember these interactions. A journal is not only a memento of these difficult and unusual times, but is also a contact tracing aid. So I encourage everyone to keep track of those interactions as well. Until a vaccine or a cure is found, these precautions are key to getting on with our lives and back to what truly matters, to the interactions that COVID-19 has taken from us. But listen, Mississauga, a little while longer. Let's take these lessons learned, let's do the 4 core behaviors, and let's be ready, and let's bring this first wave to a close in the region of Peel. Thank you, and I'll pass it back to Madam Mayor.
Thank you very much, Dr. Lowe. I want to close by thanking my residents and the businesses for their patience and for their understanding. I know these last 3 months have not been easy, but we are making progress and we are getting closer to a broader reopening. And as we're entering the new reality, the reopening of the economy, there are risks that go along with that. To avoid a larger second wave in the fall, we need to get used to the new normal and living our lives differently until a vaccine can be developed. So thank you for joining me today, and I will now take questions from the media.
Mayor Crombie, your first question comes from Sana Choi from CBC News. Sana, please go ahead.
Hello, Mayor. I have a question. Yesterday, CBC reported on the shortage of N95 masks for Mississauga firefighters, and many have had to wear cumbersome breathing apparatus when responding to medical calls. 3 months into this pandemic, how can that be possible, and what will the city be doing to address that?
Yes, absolutely. Thank you for the question. I'm going to address it, and then I'm going to pass it over to Chief Tim Beckett. Chief Beckett is working very hard to address the shortage and is securing more masks. I know that 20,000 9210s had been ordered, but unfortunately only 6,000 were received. Firefighters are safe, and they are using their SCBA gear, and those masks are very sound and make them very safe. I know the shortages are also occurring in other jurisdictions, namely in Ottawa and in Hamilton. And now I'll pass it on to Chief Beckett, who can further address the issue. Thank you for the question.
Thank you very much for the question. So Mississauga Fire and Emergency Services started into looking at our pandemic stock back in December. We had a current stock, and we knew that we were going to need more based on our SARS evidence from years past. We did procure 6,000 masks that provided us about 3 months worth of use. What we have been waiting for is another 14,000 masks that have been ordered. They haven't come in. This isn't something that fell in our lap. We also understand that N95 masks are needed in the hospital settings and in our long-term care settings. So we looked at other opportunities, other viable opportunities, and the SCBA mask, although not convenient, is a viable solution. It maintains safety for our firefighters and safety for the patients. So until we can secure more stock, the firefighters are safe, the public is safe, we're still able to provide the necessary services to the citizens, and we'll continue to work through and find viable solutions on the N95 masks. So thanks for the question.
Hi.
Do you have a follow-up, Sana?
Yes, I do. You mentioned that the City of Mississauga will be opening up day camps for children. Are those camps going to be open to children outside of Mississauga? So I'm thinking Toronto, where day camps will not be operating.
I believe our camps will give priority to our own residents, and will be operating at a limited capacity because of the reduced number of individuals and of children that we'll be able to accommodate.
Mayor Crombie, your next question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Hi, Ashley.
So yesterday, the Mississauga Board of Trade put out a statement asking if the city would press the province to enter phase 2 a bit earlier, since Mississauga's cases over the past few days, at least, or probably over the past few week or so, have been lower than cases in Brampton. I know you said today that you understand why there's a regional approach and you respect the regional approach, but if this were to persist and let's say Mississauga were to be kept out of moving into phase 2 for another 2 weeks or 3 weeks, would you consider pressing the province for a city-based approach if Brampton's numbers were to remain high and Mississauga's were to remain low going forward into July? Would that be something you would be considering?
Well, thank you for the question, Ashley. And of course, we know that the virus knows no borders and does travel. So we do operate as one region. We did press for the regional approach, and the Premier has given us just what we asked for. We asked that we make our decisions based on science, data, and evidence, and that is exactly what is happening. The good news is that we are on the downside of the curve. Case numbers are declining in Mississauga. We're seeing only about 13 new cases on average. In fact, yesterday and the day before, I was in single digits. Mississauga was in single digits. They are also coming down in Brampton. So we realize we're very, very close. And we're just asking our residents and our businesses to hang in a few days longer. We're very, very hopeful within a week or so, we should all be reopened. The entire region should be opened.
Thank you. And as a follow-up question, I was wondering what impact this 3-month shutdown has had on some of the city's, biggest development projects that have been coming down the chute for a while now. Projects like Lakeview Village and Brightwater. Have those been delayed, or do you expect them to be delayed based on the shutdown and the financial challenges that you're facing and that everyone's facing during this time?
That's an excellent question, and I'm very pleased to tell you that there has been little impact in construction. As you know, construction did not cease. Residential did for a period of a few weeks and then continued up again. We are still continuing to offer over 200 different services right here at the City of Mississauga, including, of course, fire and emergency services, transit, planning and development permits, building permits, planning applications have been processed at almost 100% rate. So all the construction work that had been done is continuing to be done.
Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Mayor Crombie.
Hi, Steve. Thank you for joining us.
Just a question around the finances of the city. I know that the city is having its first budget session next week.
That's correct.
Can you tell me with kind of the uncertainty or, whatever's going on in federal and provincial governments, has the city kind of crafted 2 budgets, one for the worst case scenario, if the other levels of government don't jump in, and 2 for a second one, which might be, the case that the other levels of government do actually help the cities, Mississauga and cities across the country.
Right. So, Steve, I will share with you that we will be given an overview of our budget as it stands next Wednesday. Of course, you know that at that time we will almost be $60 million in deficit as we bleed about $7.5 million each month as a result of transit. The good news is there have been some cost savings with respect to the 2,000 layoffs. And in addition, we will go back to fare collection as of July 2nd on our transit, so there will be some revenues continuing. And of course, now you know that the property taxes are, those bills have been sent out, and that revenue should continue. So certainly we are still very, very hopeful that the provincial and federal governments will come forward with assistance for operating revenue for our cities. They understand that the need is dire and we are in a serious financial crisis, and we're very hopeful that that message has been sent and that they are very close to coming to a resolution. I know that these discussions, in fact, are happening this week at the First Minister's tables between the premiers and the First Minister, Prime Minister himself in Ottawa.
Thank you. And then a question around the permits of patios that kind of went through council today.
Yes.
How do you ensure that kind of if there is kind of a rush to build like new patios on the sidewalk, how do you ensure that people with accessibility needs can still navigate the sidewalks effectively? And B, how do you ensure that there's still enough space to adequately physical distance for passersby?
Right. So as a city, we're trying to be innovative. We're trying to be nimble. We're trying to allow our restaurants and our bars, our pubs, get back to serving their customers and have revenue coming in once again as well. There will, of course, be inspection, and of course, all standards, building standards, will need to be met. And I know that our inspectors will be out inspecting, but we want to get them up to revenue generating once again as quickly as possible. And we're trying to be very nimble as a city to allow it. We've waived all the red tape, we've waived all the fees, and we're telling them to get ready, because as soon as they get the green light from the province to open phase 2, they can start serving.
Mayor Crombie, your next question comes from Ashwari from Red FM. Ashwari, please go ahead.
Hello, Mayor.
Hello.
The city of Markham has adopted the no mask, no service policy. In fact, the mayor of Markham is calling on the provincial government to make masks mandatory in indoor spaces. So I'd like to know from you, would the city of Mississauga also consider making masks mandatory, given how effective it has proven in other cities around the world?
So two things. First, I'll attempt to answer that, and then I'll ask Dr. Lowe for his perspective. It is my understanding that it is not in the purview of the mayor to make masks mandatory. We also are very aware that there are many individuals, including young children, people with disabilities or respiratory issues, that can't wear masks and aren't able to. And so certainly the enforcement of wearing a mask would be extremely difficult at a citywide basis. So for that reason, I don't think that it is within my legislative authority to mandate mandatory masks. I know that the Premier has said that he would not make them mandatory in Ontario as a province, and perhaps I'll ask Dr. Lowe to respond. Of course, we always recommend that everyone wear a mask where they cannot safely physically distance 2 meters or 6 feet. So it's always good policy to do so, but making them mandatory is quite a separate issue. Dr. Lowe?
Thank you, Madam Mayor, and thank you, Asrari, for the question. At this time, Peel Public Health strongly recommends the use of a non-medical mask where one cannot physically distance. The decision to make masks mandatory have a lot of other considerations that need to be taken into account. Mayor Crombie has certainly identified the potential challenges with enforcement, and also I have to say that I've been very heartened by statistics that show that many Canadians have started wearing a mask where it is not feasible to physically distance, and so certainly we are already seeing this behaviour being taken up even without a mandate. Also considering the community context where we are starting to see a decline in new cases, that gives us a bit more impetus to leave the consideration of a mandatory mask or recommending mandatory masking policies, certainly for future, potentially for a second wave. But most importantly, if it does come down, ideally it would be in a setting such as at the province, where there would actually be a consistent approach across the province of Ontario, and certainly within the context that they might be seeing in a second wave, as opposed to a piecemeal approach that might be seen in different jurisdictions here and there. That said, we certainly do continue to strongly recommend masks, and I was also happy to support the decision of Mississauga's council to make masks mandatory in public transit. Of course, recognizing that there are still the various challenges there, but recognizing that those challenges around enforcement, who can wear masks, etc., gets even more broad if we do decide to go more broadly within the community, and certainly out of step with other neighbouring communities as well. So lots of considerations. It's a really good question. Thank you, and I'll pass it back to Madam Mayor.
Next question.
Yes, thank you so much. On another note, I would like to know, are there any guidelines in place to check that all the people who are in a gathering of 10 belong to a single social circle and they aren't part of, say, multiple social circles?
So certainly we are using bylaw enforcement as a method of education. We have not been issuing tickets, and certainly we have an park ambassador program where we have redeployed some of our Parks and Rec and our community centre employees to go out and serve as our ambassadors. They wear bright blue t-shirts and wander the parks in our 10 favorite hotspots in Mississauga, and really help advise and educate our residents if they are not practicing safe physical distancing distancing or if they are gathering in large groups. Larger than
Mayor
10.
Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hey, Mayor Crombie.
Hi, Isaac.
I want to pick up on the budget issue as well and ask, we know that what you see on Wednesday will be not ideal in some way. It will be a fairly grim financial picture. And so I want to ask, can you reassure the residents of Mississauga that you have any kind of red lines? Can you guarantee that transit will be cut or that community centres won't be hit? Are there any lines in the sand you've drawn going into that where you won't touch them regardless of how bad the situation is?
Isaac, that's very difficult to predict right now. I really don't want to speak in hypotheticals. We know that the situation is very dire, and we're still very hopeful that the federal and provincial governments will come forward with financial assistance to cities to provide for our operating revenue. I know cities will be relied on and counted on to lead the stimulus, to lead the recovery when we are given the green light to reopen, and we don't want to start off a recovery by having to cut programs and services. Of course, there may have to be delays or deferrals or cancellations of some programs where we can. Certainly any capital program that we can, we will certainly look at, and if we can move those funds to operating, that's if they're tax-based, tax-funded, we could, but many of them are strictly come from DCs or cash in lieu, and then that funding cannot be moved over, or they're in reserves. There may be some creative ways that the provinces can assist us. We can look at the example and best practices in other jurisdictions in other provinces where they have assisted, but we still remain very hopeful that there will be assistance for cities, but certainly we will take a very critical eye to every line item in the budget.
Okay. And my second question relates to the patios. It's the fact that you've been very vocal and very proud about how much denser Mississauga is becoming, but the framework it's built on is still suburban. It still has large roads, wide roads, things like that. Would you want to take this opportunity where the patios are going to spill out onto the sidewalk to look at redesigning the size of some of the roads on major intersections in Mississauga, perhaps where it is becoming more dense?
So Isaac, you know, that too is something we should be looking at as a city. There are a couple of things we didn't do very well. We didn't roll out our active transportation, close down our streets quickly enough so that people could cycle and get fresh air. And this is another opportunity that allows us to be innovative and nimble and allow our patios to spill out onto the roadways and onto the sidewalks. We know in the very popular areas in Streetsville, Port Credit, and in the downtown, many of those patios exist right now, and it'll give them an opportunity to expand even further.
Mayor Crombie, your next question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Mayor Crombie. Peel Region has stopped collecting bulky items from the curbside. Currently, there are lots of mattresses, beds, tires, all bulky items labeled and left over there for weeks. Mm-hmm. What do we have to do with that? And it's not possible for people to just call 311. Mm-hmm. I believe there has to be some solution to this problem. It's a big problem now. Mm-hmm. It's not an issue.
No, you're certainly correct. This is an item that has been discussed at our Peel Region Council meetings. And let me get back to you further on when they will start collecting large, bulky items once again. Certainly residents can call in and make their request from the Waste Department at the Region of Peel, and we can see how and when it can be accommodated. So please, best to call 311.
Thank you. Can my follow-up for Dr. Liu, please?
Thank you.
Hi, Callie, go ahead with your question.
Hi, Dr. Liu. There was a study published lately in the United States about droplets, and it's underestimating the danger of surfaces compared to the droplets itself. Can you validate this, or can you elaborate on it?
So, Khaled, I'd want to see the actual study you're speaking to before I fully comment on it. But broadly, on the topic of contamination around surfaces, we do know that the New England Journal of Medicine very early on in this pandemic conducted a study that looked at how long droplets lived on surfaces. However, one thing that has not been quite clear throughout this and is, the evidence seems to point to is that surface transmission is not necessarily a major mode of transmission. What we understand is that it is typically droplets passed from person to person within that 2-meter radius and in close contact that tends to transmit this virus. And the other thing that I'll mention, at least when it comes to contaminated surfaces, is that there is a really easy way to protect oneself in the event that you may touch a surface that's contaminated, and that is through regular and frequent hand washing and avoiding touching your face. So certainly I'm not able to comment on the specific study you've identified, but I think overall the main advice to stick to the core 4 principles remains the same. Thank you very much, and I'll pass it back to Mayor Crombie.
Thank you,
There are actually no further questions, Mayor Crombie, so this will conclude today's press conference. On behalf of the Mayor, I want to thank everyone for participating and joining us today. Our media team will be sharing a link to the video of today's presser with you shortly. Thanks so much again for joining, and have a great day.
Thanks very much.